Welcome to In the Zoom Where It Happens with our hosts, Shannon Spees and Brandon Krekel.
Hi, I'm Shannon Spees.
And I'm Brandon Krekel. And today we have Patrick Sallee joining us. He is the CEO with Vibrant Health. Patrick, welcome.
Thanks for having me.
Absolutely. And we'll just jump right into the first question, if you don't mind. So tell us a little bit about yourself and what led you to become the CEO of Vibrant Health.
Well, thanks for having me. Excited to participate in this. So my name is Patrick Sallee. As you said, I'm the CEO of Vibrant Health. I have worked in the nonprofit sector in Kansas City for the last 15 years or so. Most recently, before this role, I worked at Samuel Rogers Health Center, which is a federally qualified health center on the Missouri side. This opportunity came open about 4 years ago, and it was a good fit. And we'll talk about some of the work we've been doing, I'm sure, today, but we've seen a lot of growth and it's been fun. So I'm excited to be a part of this organization and what we're doing here.
We know Samuel Rogers here. I don't know if maybe some of our members aren't necessarily familiar with what you all do. Will you give us just a quick brief of what Vibrant Health does in the community?
Yep, absolutely. So we are headquartered in Wyandotte County, Kansas City, Kansas. We have 4 locations where we provide medical, dental, and behavioral health services. We accept most forms of insurance, Medicaid, Medicare, and then we operate on a sliding fee scale for uninsured patients. So the vast majority of our patients are 200% federal poverty level or below. We operate under a federal designation that I mentioned called Federally Qualified Health Center. That designation gives us access to federal grant dollars, which has been really influential, really impactful during COVID. But it also gives us access to an increased reimbursement rate from Medicaid. So it's kind of how and then we rely beyond that on private philanthropy and foundation giving. So kind of how our economics work. But it's this year we'll see about 20,000 patients through all those services.
And they're all Wyandotte County residents, or is that
the vast majority of them are? That's not a requirement. We don't take Missouri Medicaid currently, so we aren't able to cross state lines. But most of 95% of our patients are in Wyandotte County.
And so you mentioned the community, the health and how important that is. So can you talk a little bit about your community involvement and specifically around the health equity and the COVID and the community health improvement plan
Sure.
that you brought up?
Yeah, absolutely. So part of our goal is, and part of our mission at Vibrant Health is around improving access to care and health equity in our community. Throughout the last year and a half, COVID obviously has been on everybody's radar and impacting everybody. It has hit communities like Wyandotte County harder than other communities. And our public health department really took a leadership role to step up and to form a health equity task force, which we've been a big part of, in providing testing in the community. And once vaccine became available, vaccine distribution in the community. That task force is made up of community members and leaders from a lot of different organizations and churches, community groups, to make sure we're providing our services to the hardest to reach communities and residents in our community. And it's gone really well. It's has a positive impact on Wyandotte County and our ability to get people tested and vaccinated at this point. We're also a lead organization for the Community Health Improvement Plan, which our component of that is again about health access. So while we're providing care, medical, dental, behavioral, as I said, a big part of our mission is expanding access. We believe that all people have a right to access to care, and we exist to help close that gap.
We've got a variety of chamber members, businesses in the community. How are they able to, maybe they're not the ones kind of going through the facility, but how are they able to help and assist Vibrant Health?
Sure. Well, I think there's a number of ways, particularly as we're still dealing with coming out of the COVID crisis, making sure people are getting tested and encouraging people to get vaccinated, which both of those things Vibrant Health can be a supporter in making happen. It's also, we have, like most organizations, nonprofit organizations, we have volunteer and sort of community engagement opportunities. we also, as I mentioned, rely on philanthropy. But I think one of the things we're trying to do is to make sure we're spreading the message about access to COVID testing and vaccines. So I think while it's not directly to Vibrant, continuing to have a focus on access to care and frankly specifically to COVID testing and COVID vaccines is really important for all businesses to be talking about.
And regarding the access to care and the multiple locations that you mentioned, you had 4 locations. Can you tell us about your new location that was just launched in April?
Yeah, absolutely. We just added a new clinic in partnership with Children's Mercy. So historically, we were founded from Turner House Children's Clinic. We merged operations in 2017 with a couple of other clinics that were run by University of Kansas Health System, and that's when we rebranded to Vibrant Health. And so we've had this long-standing partnership with KU that's been great and important to our growth and important to our patients. This year, we were able to add a similar relationship with Children's Mercy. So we took over operations of the Cordell Meeks Jr. Clinic at 635 and State Avenue. We support, hired, and I guess employ the front desk staff, the medical assistant staff, the nursing staff, but we contract with Children's Mercy for the providers. So all the pediatricians and nurse practitioners on site are Children's Mercy, but it is a substantial growth to our total patient population. So 2019, we saw about 10,000 patients between this Children's Mercy partnership and some family med providers from KU that we added on. We've essentially doubled our practice size in the last 6 months or so. We have some exciting opportunities coming up beyond. So we grew in April with this addition, and we decided to just keep on trucking with growth. So we have, in the coming months, we're expanding our dental practice from 3 dental operatories to 10. We're adding an in-house pharmacy that will do a lot to access prescription medication for our patients. We can pass on discount that we receive to make it affordable for patients that aren't insured. We deliver both via mail and courier, so we can get it to people next day. We're able to offer a lot of services that many healthcare providers can't.
Perfect. And I know you mentioned the dental health piece, and I believe that a part of your community outreach is school-based preventative oral health and with the children, and just I remember growing up when I was early grade school, an organization came in and taught us how to floss and how important dental health is for children, and it made me smile when I read that's a part of what Vibrant Health does and how important that is in the schools. So
oral health is a huge component of overall health, and it's just most businesses and places like us are open in the roughly 8 to 5 range, and it's tough to get kids out of school, and parents got to take off work to get kids, and it's tough. So we have a lot of effort going into getting dental services into schools, and then ideally, if those kids need follow-up care, they're coming to one of our clinics.
Well, let's look ahead here over the next year, 2 years, whatever. What are some of your goals that you're looking to accomplish coming out of the pandemic? I'm sure that kind of stopped a few things maybe that were in motion, but what's on the horizon for?
We have been able to survive pretty well. I think everybody, around here probably wants to take a deep breath and catch up, like many people around the metro. But we're really focused on health equity and what can we do outside of clinic care to provide services to our patients. So, I mentioned we're expanding dental. We've expanded our family medicine, adult medicine footprint, and that's all really, really important work. But when you think about health outcomes and we rate a community on how healthy is it, the factors that influence that ranking, 80% of those factors happen outside of a clinic space. So one of the things we talk about is if we really want to make a difference in those rankings and the overall health of a community, we got to participate in that other 80%. And so we're looking at a number of things as we go into a strategic plan, this strategic planning process this year. But one that I would highlight is medical legal partnership. We're very excited to create this. And what that means is you have a legal arrangement with an attorney or multiple attorneys that provide services to our patient population. So the best example I can give you is a family lives in a rented property that has mold. One of the children has asthma. We're trying to take care of the asthma, but the owner of the property won't treat the mold. We can't take care of the asthma until we treat the mold. So bringing legal services into an organization like ours, where many of the families are renting and certainly nimble and move regularly, it gives us the opportunity to solve that problem for the patient, which impacts their health. So it's getting further outside of what you traditionally think of as being healthcare, but it's influencing factors and having big impact on factors that influence health. And we've got to play in that space a lot to really have the impact we want to have. And so it's exciting to be at a stage where we can start talking about ideas like that, and how do we create those partnerships and those programs in our organization to impact families.
That's incredible. I mean, it makes perfect sense, just to offer that, but it's just something that I guess I never really thought about.
Well, I mean, all of it. So healthcare too often is a Band-Aid to a problem. And so I feel like we're regularly just, and frankly, I've spent my career in nonprofit organizations, and I feel like most of us in the nonprofit world are just able to do Band-Aid type stuff. We're not able to get upstream and really solve some problems. And so we're trying to think about problems now from a more as much as we can from an upstream standpoint of how do we get ahead of this instead of just being okay dealing with that child's asthma every time they come in because we can't solve it, and encouraging them to talk to their landlord or do something else or to move or whatever. We can help them solve that problem.
So when when someone comes in to one of your locations, what does that look like? Who are they meeting with? To kind of, is there like a consultation right off the bat kind of thing, or?
It's a regular. I mean, if I gave you a tour, you would feel like any medical practice you go to.
Okay.
One of the nice things that we offer is medical, dental, behavioral all under one roof. So we have, as an example, we have behavioral health integrated care in our pediatrics department. And what that means is if you bring your child in for an appointment and they're struggling with something right now, the pediatrician can recognize that. And instead of trying to also deal with something behavioral that's immediate and urgent, they can call in the behavioral health therapist who's an expert in that area. And the pediatricians can sort of get out of the way and move on and allow the therapist to have sort of a brief 15, 20-minute intervention. And that intervention sometimes is all that's needed. And asking a family to come back another day, find another time to take off work and pick the kid up and whatever needs to happen is sometimes just too much to ask. And so some situations obviously need longer care than that. But by offering an integrated model, we can solve a lot of problems that are urgent or immediate. And by offering these services all under one roof, it's much more accessible than I've got them in all of these different places.
So what is an area that you've seen of the services that you provide, whether it be dental health or mental health or women's health? What's an area that you've seen significant growth in that may be surprising or that you're expanding in that you didn't necessarily plan for?
Ooh, that's a good question. We have seen a significant growth in behavioral health. I wouldn't say that it's necessarily surprising, but it is. But it is important, and so we have seen over the last 4 years, we've gone from one behavioral health therapist to 4, and adding more as we go. We've been able to put that behavioral health services into 4 schools in the USD 500 school district, which is great. We've been able to leverage telemedicine in the last year to be able to expand access to behavioral health. So we've tried to be pretty creative and innovative about how we provide those services, which is important. I wouldn't say it's all the way surprising, but it's important. We've seen so much growth in 4 years here that frankly, every area we've grown. When I came here in 2017, we were about 25 employees. We all fit we had a potluck lunch in a relatively small conference room. And by the end of this year, we'll be about 150 employees with 20,000 patients, as I said. So it's just the growth probably that's been most surprising has been what we're able to do. And frankly, thinking about it from a scale perspective is somewhat overwhelming.
Absolutely. It sounds like it. And adding those locations and services, I mean, it definitely helps and helps with the growth as well. So.
Yeah.
Well, our time is almost up. As we talked before this, it goes very fast, and we rarely get through all of our questions. So we do like to ask one question that when we wrap up our In the Zooms and to everyone, and that would be, what is the one thing you'd like our audience to know about Vibrant Health?
Oh, man. I wouldn't prep for that question. I mean, sorry. Somewhat of my response is that we're here. I feel like we're a relatively new brand name. Turner House Children's Clinic's been around a long time. That was how we were founded. Vibrant Health started in 2017, and I still feel like we're the new kid on the block and trying to make our way. So the biggest thing would just be that we're here and we're a strong partner and healthcare provider in KCK and doing good work.
And we appreciate the work that you all do. I know it's tough work, but you guys are doing it, and it's incredible. And the lives that you impact in the area, everlasting for sure. But, Patrick, appreciate you joining us today in the Zoom. On behalf of Shannon, myself, and the Chamber, we appreciate it.
Thank you very much.
Thank you so much.